Hi everyone, my name is Tiara Brooks from School-Based Health Alliance, and we would like to thank everyone for attending today's webinar titled Children's Health and Education Mapping Tool, Introduction Tool for our School-Based Health Alliance members. Before we begin, I would like to go over a few housekeeping items. If you are viewing as a group, please go to the chat window in the question box and type in the name of person registered and the total number of additional people in the room. For example, Tiara Brooks +3. This will help us with our final attendance account. All attendees are currently in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the question box located in your GoToWebinar control window. We will address questions following the PreziTool presentation and during the tool demo. During the tool demo, we will unmute all attendees just in case you would like to ask questions during that time. This webinar is being recorded and will be archived on the School-Based Health Alliance membership dashboard in 3 to 5 business days. Just a reminder, please also visit School-Based Health Alliance for additional archived webinars. I would now like to welcome our presenter, School-Based Health Alliance Research and Evaluation Manager, Erin Scheller.
Good afternoon, everyone. Thank you for the introduction, Tiara, and thank you all for joining to get a sneak peek of our mapping tool. I'm really excited to share this with you on behalf of the team who's been working on it for seems like a while now, including Haley Lofink-Love and Samira Solomon-Hoare. The Children's Health and Education Mapping Tool will be released in conjunction with the 2013-14 Census Report on January 7th. And allow users to interact with their census data in a whole new way. This afternoon, I'll give a brief overview of the tool and some background from its development, our goals for how the tool can be used for the school-based health field and our members, and what you've all been waiting for, hopefully, a demo of the tool. As Tiara mentioned, we'll save lots of time for questions at the end, and during the demo, we will unmute you all so that you can chime in with questions as they arrive. All right. So what is the Children's Health and Education Mapping Tool? Our mapping tool builds on the power of Geographic Information Systems, or GIS, technology for data-driven decision-making for those who might be interested in addressing chronic inequities among low-income children and the social determinants of health. Indicators of children's health, education, and socioeconomic status, as well as data on public schools, school-based health centers, and other healthcare facilities are available in the tool. It can be used to assess community child and adolescent health, identify areas of need and target new services, examine characteristics of schools and school-based health centers, collaborate with and learn from local peers, advocate to policymakers, and fundraise with data and effective visuals. We're really excited that this tool will be free and available for anyone to use starting in early January. You and the rest of our members are some of our key users, so we would love to hear about your ideas for how you might use the tool in your work. We've really envisioned a wide array of stakeholders who can potentially benefit from the tool, including the school-based healthcare field, other school and child health researchers and advocates, policymakers at federal, state, and local levels, insurers and payers, funders and other grant makers, as well as individuals who might be trying to find a location for care. So the goal for the tool was really to support stakeholders across different sectors who want to address inequities in children's health, education, and well-being. The vision all along has been to bring together a variety of data on child and adolescent health, which has traditionally been kept in distinct silos, including information on school-based health centers. We want to make information about the wide variety of social and other determinants of health readily available to help think upstream about interventions and policies. So the tool really has a lens of the social determinants of health, because we know that health is determined in part by access to social and economic opportunities, resources and supports that are available in our homes, neighborhoods, communities, and schools, the safety of our workplaces, and cleanliness of food, water, air. Of course, addressing social determinants of health is something that school-based healthcare field has been doing for decades, so this is not new to us, and why we're excited to include it as part of the mapping tool, including using data on things like violence, housing, and education. So some of you might be aware that this tool has been in development for a while, and the seeds of the idea were really planted over 5 years ago. We thought about learning GIS ourselves here at the Alliance to help our members and others in the school-based healthcare field, but decided that creating an interactive tool which was widely available for all of you would be the most beneficial for everyone. So we've been partnering with Health Landscape, who created the UDS Mapper, which some of you might be aware of. And this summer we conducted some pilots of the mapping tool as well. So as we prepare to launch the tool finally in January to a wide audience, we're excited about its potential to help us build on our more and great goals to grow the number of school-based healthcare centers nationally by 30%. We know having examples of how the tool has been successfully used will be vital, both for helping users be creative in how to guide public health planning and decision-making, as well as for expanding the tool itself. We're looking to engage any early adopters of the tool to provide feedback and serve as example cases for blogs, trainings, and videos. And as I walk you through the tool and some of its main functions, we'd love any ideas our members might have of partners to work with, how to disseminate the tool, and ways that they might use the tool or develop some stories themselves. We've been saying all along that one of the main limitations of the tool is really our imagination, and we know that folks from a wide variety of different audiences will have unique and helpful perspectives to contribute. So we've really been framing the tool as having 7 core functions, and I'm going to introduce them to you here, as well as some of the data that are in the tool, and then we'll walk through some of these functions when we do the live demo. So the first function we've really thought about is using the tool for assessment. You can use the tool to see how a community compares to surrounding areas on a variety of indicators. So there are a number of county-level indicators in the tool. A user might wonder which counties in their state are underperforming relative to the national average on indicators like insurance status and high school graduation rate. The next function is to identify. Users can use the tool to identify areas with good access to health services, as well as shortage areas where there might be a need for additional services to be targeted. So you can explore facility-level data about schools, school-based health centers, and other health centers, as well as find medically underserved areas and health professional shortage areas. A user might wonder which counties have the highest level of need in their area. The next function we've thought about is planning. So once high-need areas have been identified, you can target those areas with additional health and social services. The next function we've thought about is to examine. Dig deeper into what's going on at some of the facilities that are already in these areas. So you're able to map and filter school and school-based health center locations based on key characteristics and see some additional data about them, like their population size, the grade levels they've served. For school-based health centers, you can look at their staffing profiles, hours of operation. Examine and look at schools that serve adolescents or receive Title I funding and think about those as potential locations for a new school-based health center. The tool can also be used for collaboration purposes. So you can find other resources in your area and potentially collaborate with those organizations to potentially sponsor school-based health centers, or find out what's working in communities that are doing really well on certain outcomes, or form relationships and work together to try to improve areas that you want to work on. The tool can also be used to raise awareness. So once you create maps during the assessment, identification, planning, and collaboration process, you're able to print and save them and take them to key stakeholders, such as policymakers in your area. A user might ask, how can I use the data that's displayed in the tool to create a visually persuasive item to demonstrate the need in my community? The last function we've really thought about is fundraising. So because data from a wide variety of sources are available in one location, we're hopeful that the tool will be useful for people in writing grant applications as well as reports to funders. So now that we've thought about how the tool can be used and some of its main functions, we'll look next at some of the data sources, the specific data points and indicators that are available in the tool, as well as a few of the limitations. So what are the data sources for the tool? These data come from a number of different national data sources. We've pulled in data from the census, from HRSA, the Centers for Disease Control and Prevention, Indicators Warehouse, and Atlas, as well as the Robert Wood Johnson Foundation's County Health Rankings and Roadmaps tool. And what we're very excited about from the most recent census of school-based health centers. So the mapping tool will be loaded with the 2013-14 census data that we collect every 3 years. So we're excited for this to be a repository of all of the new data that you all have helped us so graciously over the last year to collect. And this will really allow users to interact with their census data in a whole new way. So what are the data points that are in the mapping tool? So there are data on health insurance and coverage indicators, including the percent of children under 18 who are on Medicaid or CHIP, as well as the percent under 18 who are uninsured. And all of these indicators are available at the county level. Likewise, our other health indicators are available at the county level. We look at teen birth rate, percent of obese adults, food insecurity for the total population, and chlamydia rate for the total population. Right now, our indicator related to education is percent of adults with no high school diploma. And we include, as I mentioned, some information on demographic and socioeconomic indicators. So we look at percent of students who are eligible for free or reduced lunch, percent of kids who are living in poverty or single-parent households, as well as those with severe housing problems and the violent crime rate in each county. There's also information available at the school level for all public schools in the U.S. So we have their locations, their Title I eligibility status, their enrollment, what grade levels they serve, and the free and reduced lunch eligibility. Our SBHC data from the census include the location of all school-based health centers, as well as their sponsor types and staffing model, the hours that they're open, whether they serve populations besides those, just students in the school, whether they serve adolescents, the grade levels served, and free and reduced lunch in the school. Data are also available on other healthcare facilities as well as shortage areas. So as I mentioned, we have the location of all hospitals, FQHCs and lookalikes, rural health clinics, substance abuse treatment centers, as well as health professional shortage areas for primary care, mental health, and dental health, as well as medically underserved areas. So there are a few limitations to the data, and I'll touch on those briefly as well. As I mentioned, county-level data is the most discrete geography with data available in the tool. There is an option to upload your own, more local data. For instance, if you wanted to look at poverty rates by census tract within your county, you could upload your own data and look at those points. Our website in the resources section of the tool describes each of the data sources in more detail, but the data come from different sources, so there may be specific counties that are missing data for some of the indicators, and the years are not the same across all of the indicators that are included in the tool. The tool also looks at data at a point in time and is not longitudinal, so it can't help explain why there might be a county that is underperforming on a particular indicator. Lastly, the tool does not have the ability to capture or test for statistically significant differences between counties or states and indicator values. And now I'm going to get to the part that everyone is really excited for, diving into the tool. We really want this to be interactive, so you can jump in with questions. And here you can also see the link will be available. And I am just going to briefly switch to the tool.
everyone. We're going to start the tool demo shortly. If you do not have any questions at the moment, if you can please mute your phone to avoid any background noise. And when you're ready to speak, if you can unmute your phone and then just announce your name. Thank you.
Great, thank you, Tira. So as I mentioned, just chime in if you have any questions. So I'm going to give first a brief demo of the tool to get you a little bit acquainted with it, and then we'll dive deeper into the core public health functions that we think it's useful for with a specific public health scenario. So using this to win more and great. Sorry, was there a question? No? Okay. As we're aiming to grow the field by 30%, we think that this tool has the potential to identify nationally counties that are underperforming across many of these different indicators that are included in the tool. We can use the tool to look at where school-based health centers are now, as well as schools, and then dive deeper to learn more about schools in some of these counties, as well as underserved areas and potential partners. So the tool can look nationally or at specific states, but I'm going to start looking nationally and thinking about our more goal for this introduction. There are three main layers in the Children's Health and Education Mapping Tool. The first is the Child Health and Education Indicators, which is the layer that's open right now. This lets you select any state or the whole country and search, map, and compare county-level information on indicators including health insurance and coverage, health, education, and demographic and socioeconomic status. So I've selected the entire country, and we'll see what it looks like when we start by selecting one indicator. So if I wanted to see all the counties that are underperforming relative to the national average for the percent of children who are on Medicaid or CHIP, I would just select this checkbox, and you can see everything, all the counties that are underperforming compared with the national average, which is about 36%, become highlighted in blue. So you can also see the indicators that you've selected over here in the legend. So we can see there's a lot of variation across the United States. One thing that's exciting about this part of the tool is the ability to hover over a county to see some information, including its name, the population size, the number of public schools there, whether there are any school-based health centers in the county as well as the entire state, and a little bit of basic demographic information. So next, I'm going to select a couple more indicators. One thing that's really useful about the tool is the ability to see counties that are underperforming across multiple indicators. So if I also wanted to look at counties where there were a large proportion of adults with no high school diploma, I could select that indicator as well. Here we see that the counties that are showing up now in darker blue are underperforming compared to the national average for both percent of kids on CHIP as well as percent of adults with no high school diploma. And if I add some additional indicators, then it will continue to darken. So again, each of these points is set to the national average because that's an easy comparison. But if you wanted to move this to, for example, compare for your state average, you could just click on that ball and you're able to change and set whatever comparison rate you want to. One other thing you might have noticed when I've been selecting all of these indicators is the high needs area identifier here in the bottom right. So this allows us to look specifically at counties that are underperforming on a particular number of indicators. So I've selected 3 indicators so far on my map, and I see that perhaps the southeast part of the country has a lot of counties that are underperforming on all of the indicators. And I can tell that by hovering over the bar for 3 indicators. This now highlights only the counties that are underperforming for percent of kids in poverty, adults without a high school diploma, and kids who are on Medicaid or CHIP. So it also tells me there, we can see the geography count is 868, and that means that there are about 900 counties across the U.S. that are underperforming compared with the national average on all 3 of these indicators. So we're really excited about this function to select some of the high need areas. And I see that there is a request also to look at free or reduced lunch, so I can add that on here. And now it's again showing all 4 of the indicators that we have selected. And if we wanted to, we could hover and see counties that are underperforming across all of those. If we wanted to, again, go back and look just at free or reduced lunch, which Sarah's requesting, we can just unclick all of these others. And now we can see only counties that are underperforming for percent free or reduced lunch. And I think we can hover and you can see that Seattle does not appear to be one of those counties. I'm just going to turn back on a few indicators so that we can see counties that are really standing out on some of these. And now I'm going to jump quickly to the second layer, which is the SBHCs and school characteristics. This allows you to map locations of, filter, and view characteristics of public schools and school-based health centers. And since you all are our members and probably most interested in school-based health centers, I'll start with those. So when I click on the checkbox next to SBHCs, it'll take a minute to load, and now we can see the location of all of the school-based health centers that were captured in our 2013-14 census. I'm just scrolling over here in the legend because, as you can see, there's 2 different colored dots. Those that are green are SBHCs that provided their census data to us, which, again, we are so appreciative of and are excited that their data can be included here. And the SBHCs shown in bronze didn't supply census data. And that's important because using the filter option over here, you can only do that for those sites that provided us with census data. So if I'm an FQHC and interested in finding all of the SBHCs that are sponsored by other FQHCs or lookalikes, I can filter by selecting that. And as you can see, only 809 school-based health centers remain on the map here. One other thing that's interesting about this layer is you can click on a particular school-based health center and find a yellow pop-up box that will tell you a little bit more information. So here you can see there's some data about the school itself. These data are from NCES about whether they received Title I funding, the lowest grade level offered, and a little bit of demographic information. But then here there's also some information about the school-based health center itself, including the sponsor type, their staffing model, hours of operation, grade level served, whether they have an EHR or serve adolescents. And as you can see, this particular school-based health center, it looks like only gave us some of their data points, but we can see there are data on some of them. So I'm going to turn off the SBHCs and show you briefly the public schools. So there are going to be a significant number of blue flags across the U.S. for all of the many public schools in the country. So here in our legend, it tells us the number that we're seeing on the map here. It's close to 100,000, so that's why it's so hard to read. But you could filter, for example, on grade level if we wanted to see only schools that have their lowest grade as kindergarten, and that'll remove a lot of them from the map. And similar to the school-based health centers layer, we can click on a particular flag and find out some basic data about that school. Okay, and I'm just going to turn this layer back off and go to the third main layer, which is the base maps and optional layers. This layer has a few interesting functions. One is, right now we can see our map is really basic, just kind of gray. If you wanted to see a more traditional map that has some of the topographic features, you could turn that on. And I'm just going to take that back off. You can also, if you wanted to see state boundaries or names, you can add that. And interestingly, you're able to add the location of other healthcare facilities that might be potential partners for school-based health centers or referral resources. So I'm just going to select hospitals. You can see there's also a lot of hospitals across the U.S., so you can see all of the different types color-coded over here. And One other feature we're really excited about is we already looked at the points for school-based health centers. And we are also able to flag specifically at the county level whether or not a county has a school-based health center. So here we can see all the counties that do have a school-based health center, and we can see easily now some of these high-need areas where there are not school-based health centers. And so we're excited from the Alliance's standpoint as thinking about those counties as ones where we might want to think about expanding school-based health centers to help us grow 30% in the next few years. You can also see counties that don't have school-based health centers, and as we all know, there are unfortunately a lot more of those right now. We can also look at some state SBHC partners, so some of you might be from our affiliates, and we can see states that have affiliates or program offices. So there are just two other quick things I'll highlight that you can do from the tool before jumping into an example. One is that there is an ability to upload your own data with Map My Data Point or My Communities data. So you can, if you have data on different address points, you can add those, or if you have information about zip codes and things like that, you can add those there as well. And I also want to show you our data tab. And this one I'm just going to pull up a new table. So you can also go to the data tab and see all of the indicators that are available from the Children's Health and Education Indicators layer. And you're also able to download all of these data points and export them, so you can use them to look at however you would like for your particular purposes. And one other thing before we jump into our promised demo, there's also a resources tab within the tool that's useful. We're currently planning to have a lot of different resources available from the School-Based Health Alliance's website, but there is a resources tab that will have some information including user guides, FAQs, and some videos available in the mapping tool itself here. So I'm going to go back to the Child Health and Education Indicators. Okay, so I'm just going to hit reset here and get rid of these data points. So I'm going to walk through an example to demonstrate some of the key functions, especially for those who might be new to GIS, since this provides a basic intro to thinking geographically and visually about some public health issues. So this scenario is based on publicly available data, but it's really only an example, so a comprehensive strategy would require some local level understanding, perspectives, and additional data. And we're going to use Arkansas here, but we could select many different states for potential scenarios. So for this scenario, I'm going to imagine that you are an adolescent health advocate working to reduce teen births in Arkansas. So we know that the national teen birth rate is 26.5 births per 1,000 females 15 to 19. It's particularly high in Arkansas. So you're working collaboratively with representatives from the Department of Ed and Health to develop a comprehensive strategy to address this issue because it can influence the number of young people completing high school and is particularly prevalent among low-income communities. So we're trying to engage a broad coalition to address this issue. And we've included stakeholders like community organizations, advocates, and researchers to form a local task force to think about creative and innovative interventions. And since I just learned about the School-Based Health Alliance's Child Health and Education Mapping Tool, I want to explore how it might be used as part of the process to tackle this public health problem. Your goal is to bring information to state legislators to convince them that it's time for the state to consider expanding access to reproductive health services for adolescents, and that it would be wise to invest the state's resources and additional services in targeted locations to address this issue. So the first question that you and your task force want to address is whether or not the teen birth rate is higher than the national average in all counties in Arkansas, or where there are particular pockets of high need. So to do that, I've gone to Arkansas, and I can scroll down and select the teen birth rate. Remember, again, this is set automatically to the national average so that we can see, with the exception of about 3 counties, most of the counties in Arkansas are underperforming compared with the national average. If I wanted to move this to the average just in Arkansas for comparison, which is about 43 births, I could easily do that. And we see that there's still, unfortunately, many counties that could use some additional work potentially in this area. So knowing that teen birth rate often goes hand in hand with poverty and education, I'm going to also look at counties where there's a large proportion of adults without a high school diploma and a large proportion of kids living in poverty relative to the national average. So we can see that there's still a lot of counties that are in a dark shade of blue here, meaning that they're underperforming relative to the national average across all of these indicators. And if I really wanted to pick out only those counties, I can click on the bar for 3 in my high needs area identifier and see that there are 60 counties that meet those different criteria. And if I forget for some reason what I selected, I can again come over to my legend here, and it will tell me what the benchmark is that I've set for each of these individual indicators. Again, if I wanted to see more information about these counties, I can hover over them and get some additional key facts. So now that I see that there's a lot of counties in Arkansas that are potentially high need, I'm going to go to my base max and optional layer because I want to know what areas meet the criteria for being medically underserved areas and where there might be a shortage of primary care providers. So when I click on the HPSAs for primary care, I see that there are definitely some counties and areas across Arkansas where there's few primary care providers relative to the population. So it seems particularly common across southern Arkansas. If I wanted to also look at medically underserved areas, I can select that and see that that's even more common across the entire region. But again, especially it looks like in southwest Arkansas. So I'm going to turn those back off now that I've identified some general areas. And after conversations with experts and reviewing the Community Preventive Services Task Force recent recommendation that school-based health centers can improve health outcomes and access to services, you and your local task force decide to establish and strengthen SBHCs in your state as one component of a comprehensive strategy to address this high teen birth rate. So in order to do that, you and your local task force want to understand how many public schools are eligible for Title I funding in these high-need counties, since those are commonly where school-based health centers are. So to do that, I'm going to go back to the school-based health centers layer and click on public schools and see that there's a fair number of them across Arkansas. Since I'm only interested, and I'm going to just hit reset and show all since it saved what I did earlier. I'm interested only in Title I eligible schools, so I'm going to select that filter, and we see that it removed some of the schools that I was looking at. So I want to also look at some of these schools down here in this region that I've identified as being potentially high need and click on some of those flags to see what types of schools are there. And that's an elementary school, so probably not one that I would necessarily be interested in. So if I wanted to, I can also filter based on school level here. But before I do that, maybe I want to also know where the school-based health centers already are in Arkansas, and if they are in any high-need counties. So I can see that there are a few school-based health centers in Arkansas, but they're primarily in northwest Arkansas, and there aren't as many down here where we identified as a particularly high-need area. So if I wanted to go and talk with some of the school-based health centers in Arkansas already to find out what types of models they have, I can click on that and see that for Cross County School District, they do serve adolescents. They have EHRs, and we can see that they're sponsored by an FQHC. So maybe my team wants to go talk with the sponsor in that school-based health center to learn how they got started there, whether or not they're potentially providing any reproductive health services, so I can learn from them. And while I'm here, if I wanted to identify schools that might be potential ones that I could put a new school-based health center in southeast Arkansas, I might want to look only at schools that are serving adolescents. So since we define that as 6th grade and older, I'll just go ahead and select all of those grade levels. And we can see that there are still a fair number of them in southeast Arkansas. And I'm going to use the draw feature just so that I can keep track of this as a high-need area. So using the draw feature, you're able to draw whatever notes you want on your map. But I'm just going to make a rectangle here to indicate that this is where, and I'm just going to clear both of those and start over. This is an area that I am interested in. Okay. So now that we've assessed all these different aspects of child and adolescent health, education, and a little bit about socioeconomic status, we found some high-need areas here in southeast Arkansas and learned a little bit about some of the characteristics of schools and SBHCs already in Arkansas. We're ready to find some potential other partners and advocate to policymakers to expand our school-based health centers. So I want to know if there are any federally qualified health centers or lookalikes in southeast Arkansas so that I can see if they might be interested in sponsoring a new SBHC. So I'll go to the base maps and optional layers and just click on health center programs. And I can see that there are a few across this area that I've identified where I want to build some new school-based health centers. So you are able to zoom in and see the facility's name, so you could get their contact information that way. And if I wanted to go to a partner and potentially work with, for example, the Boys and Girls Club, I could add those locations by mapping my own data point. And you can click here to begin, and I already have some information set up for their addresses. And you just have to include some key information. And when you paste it in, we'll see that there are a few Boys and Girls Club locations here. So this new dot is a point, meaning that it's information that I added. So if I wanted to, I could add some additional information or data that way. And whenever you move the map or zoom in or out from the child health and education indicators layer, we'll just have to click back there to find those highest need counties again. So now that I'm ready to go, I have some potential partners in high need areas, and I want to take this map to a policymaker. I am able to print it as a PDF, and I can also share it and get a URL to share with other people on my team so they can continue to edit it, or so I can come back to it later. And hopefully we will be able to take this information and expand the number of school-based health centers there in Southeast Arkansas. But that is all we have for our demo, and thank you so much for your time. And we're really excited to hear any questions that you all might have, as well as any ideas you might have about how you could use the tool in your own work. And I see a question here from Kristen about if the tool will be available to everyone or only members. So the tool will be available to the public widely once it launches in January, not just our members. But we're excited to give you all a sneak peek and engage you all as adopters who might be able to provide example cases for us, and we'll be providing lots of TA along the way. I also see another question from Kristen here in the chat box about, for states who have invested in their own GIS capacity, are these data, especially the SBHC data, available to download to perform a more detailed analysis? So that's a great question, Kristen. Right now, the data that are available to download from the tool are only from this child health and education indicators layer. So things about health, education, and some demographics. The school-based health centers layer, those data points are not available to download, but if you're interested in doing some sort of more detailed analysis, we can definitely talk about that. There is a process that everyone can go through to request the 2013-14 census data, and you can just email research@sbhforall.org for anyone who's interested in trying to go through that process. And we would address that on a case-by-case basis.
And just again, we want to remind everyone that you are unmuted. So like Erin said, if you have any comments or ideas or any more questions, feel free. The phone line is open for everyone to speak.
And I guess I'll just say, too, that I hope after seeing the tool in action, it makes you want to jump in and play with it yourselves. And I know there's still a couple weeks to go until then. So if there's anything that anyone wants to see now, like particular states or counties or data, I'm more than happy to act on your behalf and show you any of those things if you're interested. And I know that you all are from a wide variety of different places and backgrounds, so I would also just pose a question to you all and ask how you could imagine using this tool in your work. We're really excited to hear about how people who are actually out in the field could use this so that we can continue to expand on it. And I see a question from Heather. Hi, Heather. About whether the tool includes Alaska and Hawaii, and it does include Alaska and Hawaii. It just, you kind of have to go to those states specifically. So from this layer, and actually I'm going to turn a few things off since when you zoom out it gets busier and busier if you don't have a particular item that you're looking at. But I know, Heather, I think that you are from Alaska. We'll go there and cross our fingers that that is working. It looks like like it's still taking a minute there to load, or I'll have to check if we have data for Alaska. I'm glad that you asked, Heather, and I will definitely follow up with you. I also see a question here from Julie about, can you show me how many SBHCs gave data for Pennsylvania? I'm going to reset these other things just so we can get a little bit of So we'll go into the Child Health and Education Indicators layer and zoom into Pennsylvania. And then I'll go to SBHCs and school characteristics. And I can see that there are 158 SBHCs across what's visible right now on the map. And while I can't, unfortunately, one thing that we recognize as a limitation of the tool is that it really, within this layer, it shows you everything available in this screen, not just a particular state. So I can see here for Pennsylvania that all of the SBHCs that we have in the map did give us data, but I think that there might be a couple others in Pennsylvania that we did not get data for. So I can check on that separately too, and that will be available in our census report. We'll be able to see how many school-based health centers we had for each state. And I see a question from Terry. How will we be able to save maps that we've created other than printing it? So that's a great question, Terry. So when you go to this share function, it'll generate a link, and that's, I guess, a stable link. So once you have that, it'll always link back to the map as you last worked on it. So you can go back to this map in the future if you want to alter anything, or if you want to share it with your team members and kind of have it there saved that way. So you can print it, but you can also have this link that will essentially save it for you. I guess along the lines of thinking about how you might imagine using this tool in your work, we'd also love to hear from you if there are other partners that you could imagine engaging in this work that we should reach out to, or audiences that you might envision bringing a map to for advocacy or fundraising purposes. All right, we're going to give everyone at least 1 or 2 more minutes if they have any questions. Please don't be shy. The line is open for you guys to speak, or you can still enter your questions in the question box. Okay, well, if there are no other questions here, and I will hang around for a minute, but we really appreciate you all taking the time to join this webinar and get a sneak peek at the mapping tool. I hope that you all are as excited about it now as we are, and that you will share this widely with all of your teammates and colleagues and others that you work with. Again, it will be released on January 7th in conjunction with our new census report. And we will, as Tiara mentioned, be posting the webinar to our members page. And we will also have ongoing training sessions similar to this with perhaps some more guided scenarios specific to different stakeholders that we envision using the tool beginning in January. So there will be another webinar on January 14th to introduce the tool to everyone who didn't get to join today. So thank you again for your time, and we look forward to you all using the tool.
Thank you, everyone, and thank you again, Erin, for this amazing presentation. Have a wonderful day, everyone.